Good morning. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our weekly update. We're in a different location. We're here at the Peoria County Headington Oak facility, which is the Health Department's COVID-19 vaccine clinic. We do have an esteemed guest with us today to kind of start off this discussion. So with that, I'll turn it over to Chairman Andrew Rand from Peoria County.
Thank you, Monica. I'm not the esteemed guest. Let me start
you are.
Let me start right there, and I'm going to take this off, or I won't be able to breathe. I've asked Councilman Ruckriegel to join me yesterday because I wanted to take 1 minute to talk about something he was involved in reviewing yesterday. As the ability to get these vaccines out where they need be, and not in a mass distribution center like this one, has also been a subject for the health department, and Monica in particular. Yesterday, with her staff from my office at AMT, we were vaccinating out at St. Charbel's Community Center, and also delivering to the apartments within the St. Charbel's facility, which, if you don't know, is pretty large. And I'd asked Sid to join me so he could see the effort that the city county health department was making to get these vaccines out to people who cannot travel on icky days like yesterday, or who have other infirmities that prevent them from traveling. So I just want to continue to congratulate Monica on this effort as she has figured out multiple pathways to see to it that folks are rapidly getting their first and second doses. Now, the big ticket today, Representative Bustos, I have known since she was first elected. She is beyond successful. She is beyond bright and brilliant. She is beyond hardworking. She is an angel, I think, to the district that she represents. All comers, Republicans, Democrats, women, men, people of color, everyone. And I'm so proud to know her through these many years because she has consistently had a moral compass that's pointed true north, and everything she does is in the interest of super ethics and super constituent services. And I have come to trust every word out of her mouth. And that's a long order for some of our representatives in Washington, D.C., but that I don't want to talk about. She recently said that this vaccine may be the savior of our nation, or a savior. I don't want to get the pronoun misguided there. And I think she's right. Certainly her experience many years ago in journalism, and then institutional health care with the, gosh, what did we call it before Unity Point?
Iowa Health System.
Iowa Health System.
We'll just stick to Unity Point. I never liked that name being in Illinois.
Had put her, on the front lines of understanding the evolution of healthcare in communities from a primary care perspective, doctors' offices and clinics, all the way up in institutional healthcare, and she is no stranger to this conversation. As the representative from the 17th district, she obviously has taken a look at how the vaccine is being distributed in her counties, to which she has an obligation to help. And I'm just so proud that she's back in Peoria again, studying the landscape, and in particular, Monica Hendrickson, who all of us know, and I know you guys like the back of my hand after the first 5 months of daily press conferences we did at the health department. She has done one yeoman's job, and we aim to keep her. So with that, my friend and our representative in D.C. who gives a damn and tells the truth every single time, Sherry Bustos.
All right. Thank you, Andrew. Really appreciate it. Monica, thank you, Sid. Thank you. The path back to normalcy is right through here. It is right through here. What do I mean by that? First of all, 14 counties in the congressional district that I serve, there's nobody who's getting out more vaccinations than Peoria County. Number one out of all 14, and really by far. So I want to congratulate Monica. I want to congratulate Andrew for overseeing this process in such an efficient way. I just did a walkthrough of this facility and it is running like clockwork. Now, how are we going to make sure that we even up the ante here? We need more vaccination. So here's what I can tell you. We are in the middle of negotiating right now the next COVID relief package. Joe Biden, as of today, has been president for 3 weeks. We now have a national strategy. We soon will have the next COVID relief package that will have more funding to make sure that the Peoria County Health Department, the local OSF and Unity Point, Walgreens, CVS, Hy-Vee, Kroger, everybody will have more doses. That's what we need, because they've got the mechanism in place, they have the logistics down to be able to go from the vaccination to the arm. So I'm confident that when we deliver on this next package and have more funding to make sure that we can produce more syringes through the Defense Production Act, that we can produce more vials, that Moderna and Pfizer and soon Johnson & Johnson can get more of those vaccines to places like Peoria County and all the other counties in the state of Illinois and all of the counties in the United States. So that is really what has to happen. The structure is in place to move that along. So just as Joe Biden said when he was president-elect, that help is on the way, I will say today that more help is on the way. So with that, Sid, are you speaking?
Yeah, he's
No.
just the wall.
Okay. Okay, but I'm sure Monica and Andrew and I can answer any questions that you may have.
I guess my question would be, you cleared the way for the budget reconciliation process last week.
Yep.
So now we're at the point where we're talking about what's the timeline for getting the president's COVID relief package pushed through, and will that include the component that ups the production of COVID vaccinations?
The sense of urgency around this is around March, because that is when many of the components that we passed in late December expire. And so we are not going to get past the expiration date. That's not the way we're going to do things anymore. That is pre-Biden administration. That is pre the fact that we are in the majority in the House and the Senate and now in the White House, and so we will not get past that deadline. And that's coming up in March. I just was on a leadership call yesterday with the Speaker of the House, with the majority leader and the majority whip, and we talked about how we can get this work done now out of our committees. When I leave here, I have committee work. We're doing most of those by Zoom because of social distancing, and where we are doing our markup out of the committee I'm on to make sure that we can send that legislative work over to Ways and Means from a tax perspective, and make sure that we're getting that work done where we are not going to wait till that last day and then have to have some kind of continuing resolution, which is how Washington has been operating for a number of years. So there's a real sense of urgency around this, and we will get it passed.
You mentioned the relief bill in terms of providing funds and resources to help acquire more vaccines. Is the issue being able to buy the vaccines or just overall availability of vaccines?
It is the availability of the vaccine. It's not a matter of buying it. We have ordered hundreds of millions of doses now. We will have enough doses paid for to vaccinate every American who wants to be vaccinated. It cannot be produced fast enough. That is why, this is something that we had been calling for months and months last year under the previous administration to invoke the Defense Production Act. Joe Biden has done that. And this is a way how we get to the product faster. It's how we get more of the doses. It's how we get more of the syringes, how we get more of the vials. And so this has to be a whole of government and the private sector combined in order to tackle one of the greatest public health challenges that we have faced in the last 100 years.
Just a quick follow-up. Everyone wants to obviously increase the vaccination rate. Is the COVID relief bill going to do that, or will the Defense Production Bill do that? What will ensure that, because you said before, availability?
Yeah, I can answer that. The Defense Production Act was invoked through an executive action. The next COVID relief package, which is a $1.9 trillion package, That has everything from more funding for COVID relief, more funding for our National Guard to stand up standalone clinics, or if we need more help to get the vaccinations into people's arms. All the funding, I mean, the Peoria County Health Department does not have enough money to pay for everything that it needs to do to be able to vaccine everybody in this county who wants to be vaccinated. So part of it will be to make sure that Peoria County has the money that it needs to get the job done. The other component that will be very, very important part of this COVID relief package is we will have money for our towns, for our counties, for our townships in this next package. That is something that we have passed as House Democrats that hit literally a brick wall where the Senate wouldn't even take that up. And Andrew Rand can tell you firsthand the needs of Peoria County. You can talk to any county executive, any county board chair, or any county administrator, and they will all tell you they need help. You can talk to pretty much any mayor of any town in the state of Illinois, and they will tell you they need help. And help is on the way in this next COVID relief package for our towns and our counties and our townships to make sure that they can pay the bills despite the fact that their tax revenues are down. So that is part of this as well. That will help make sure that Monica Hendrickson can get this job done and make sure that everybody in Peoria County who wants to be vaccinated can be.
In terms of availability of the vaccines, obviously Monica can't make them more available until she gets more of a shipment. In terms of federal government, how will she get more vaccines? How will that change?
Part of it is through the Defense Production Act. Part of it is that Moderna and Pfizer and Johnson & Johnson need to be working 24/7. It might even go beyond that to share. This is getting into areas where the legalities I don't know enough about, but maybe we have other pharmaceutical companies who can manufacture this as well, even though this is a Pfizer product or a Moderna product or a Johnson & Johnson product. But this literally has to be one of those things where everybody who is able to help get this done is and needs to step forward to make sure that we can get this job done.
In terms of the next stimulus, are you still looking at $1,400 for individuals? And is that component also going to come during March along with the rest of it?
Yes. Yeah, that's part of this next COVID relief package. We are still looking at $1,400. Part of the debate has been what's the income cutoff for folks who will get that. We are still at $75,000 per individual, $150,000 per couple. That is still what that is right now. Now, it doesn't mean that by the time this is passed, that doesn't change, but right now that is still the limit.
You mentioned the Defense Production Act for syringes and vials and things like that. So is it not just the vaccine doses we're lacking right now, it's also syringes and vials?
Yeah, I can actually have, Monica maybe would be the best one, like on the ground, what we're seeing. I know on a national level, we need more syringes, we need more vials. We still need gloves. Rubber gloves are part of it, some of the personal protective equipment. I think we're in a better place now. I think Monica would probably be the best one to say on the ground what you're seeing. You might have a better idea if you'd like to handle that. I know that what it is on a national level, but on a local level, she would be better to answer that.
So I think the key to understand is that at local level, we want the vaccine. And for it to come, it needs to be in vials, it needs to be sealed, we need to have the kits to actually administer it. So part of it is, I think a lot of times when we think of vaccine, we think of the liquid in the bottle, but there is a large manufacturing portion that goes with it. Storage, shipment boxes, even dry ice. And so that's why it's very important that to bring in all sectors that are involved in everything from the liquid, how it gets transported and gets put into an arm, are brought into gear. And that's why we're also excited to hear about funds coming to local health departments as to other entities, because we also want to get dispensers, as their terms, people to get actual vaccine into arms as well, so another component. And likewise, this is a great facility we're using. It's a county facility. We've had that opportunity. Other communities don't have that, and so they're having to look at larger spaces as well and the cost associated with that. So it's not just about manufacturing the actual liquid, but it's everything that goes with it.
What's your assessment of the current supply of those, of the liquids, of the syringes, of all the supplies? What's your assessment of the current supply in terms of the Peoria City County Department?
So right now, in terms of our current supply, because we receive with our vaccine an ancillary kit, which contains all of those additional points, we're able to get a lot of it together, but we don't know if the production lacking happens from just the glass bottles that's being manufactured or the dry ice component. We will love to have more vaccine in our community. Our community wants it, they need it, and so we're more than happy to take on those additional points. I will say there are some things that are not in that ancillary kit that we have to procure on our own, gloves being a great example of it. And so those are things that we are realizing that there's caps on how many gloves we can purchase at a time from some of our distributors. So all of that is really what we're hoping to get some relief with the bill's look.
How many doses are we getting a week now? Was it a week or a month that we were saying we were getting 5,000, 7,000? How many doses are we getting now?
We're just over 2,000 a week. And again, the way it works in Illinois is that allocation comes to the local health department, and then I distribute it to our community partners, which includes the 2 hospital systems and our federally qualified health center, as well as maybe some standalone options that are out there. The pharmacies, the Walgreens, Hy-Vee, Kroger, and CVS, they get that allocation from the federal pharmacy program, so it does not come through the local health department.
Do you know how much they're getting?
No, again, that's at a federal level.
So now the 5,000 to 7,000, the number that I'm thinking of before, was that a month?
That's what we were hoping to start gearing up towards.
We were getting that each month, right?
We were hoping to get that much each month, and we are about getting, roughly, 8,000 a month, but we really would like to see more of that. The facility that we're standing in here, the health department one, on an average week, we can take 1,500 first dose appointments, and in the field, as Chairman Rand mentioned, we can do another 500 rather easily. So that 2,000 we could use on our own, but because we are doing this as a community response, we're making sure that we're able to provide vaccine to our hospital systems and our federally qualified health center too.
But that number has not grown. It's been steady. The whole time.
It staggers, but sometimes there are some extra trays that we're able to allocate over to us, so we might get another 2 or 3 extra trays. That gives us another 2,000 in our community, but consistently we're receiving 2,000.
As far as data, I had a question with, last Friday, there was reported to be 11 people in area ICUs with or under investigation for COVID. And Monday, that jumped to 26, and then yesterday it was reported to be back down to 9. What was the reason for that?
I would direct that question to the hospital systems. They do have, again, a nice ebb and flow, too, with their ICU usage as well, so that would be something for them to fully understand.
We've had people reach out to us saying they got their first shot, now they are not sure if they're going to be able to get the second shot, kind of uncertain. What would you say to someone ensuring them, there is a second dose if you get that first one?
So the question about getting your second dose, first and foremost, you really should be going to the same location that you got your first dose at. So if you get it at your local health department, touch base with your local health department, same with the hospital systems. And if you get it at one of our large pharmacy programs, the Kroger, Hy-Vee, CVS, or Walgreens, you need to reach out back to them. And that's really key because the way we get allocated second doses is based on how many first doses we have been given. So that's really important to make sure you go to the same point. We've seen consistently that the state has been providing the second dose release right at the 3-week mark, so getting us prepared to make sure that we have that second dose clinic operational. Here in our clinic, as well as I do believe in Tazewell County, they're actually even scheduling people when they leave their first dose with their second dose appointment.
Monica, if you were to suddenly start getting a lot more vaccine, would you be able to handle it, on some of these ancillary things that we were talking about?
So if we got anywhere between 10 to 15,000 doses a week, between our health department, the 2 hospital systems, and the federally qualified health center, we would be able to support that.
That's a big jump.
It is, but that just shows you that we are prepared and have the logistics in place to actually do a large-scale operation like that.
Congressman, are you still confident in the President's 100 million shots in 100 days figure they first proposed?
I'm more than confident. I think it'll be more than that. I mean, we started out with administering 1 million doses a day. We are now closing in on 1.5 million doses a day. Again, this is nationally. So obviously that adds up to more than 100 million. That'd be somewhere, almost 50% more. So no, I'm very confident that that's going to happen. But to Monica's point, that's the moral of the story here. Now, not all the counties have things down to this level of handling all of the logistics. Again, Peoria County, out of all 14 counties in our congressional district, is #1. So, and the fact that she could say she could take, 7 times what she's getting right now and still handle all that. That's the groundwork that not everybody's getting right. They've got the groundwork done here and ready to go. So it's now incumbent upon the manufacturers of this and the federal government to make sure that we are increasing the amount of doses that we are able to get out to all of our communities. That is how we will get back to normal in this country. And so that it's critically important. But I am very confident that the Biden administration will oversee a plan where those numbers that we're getting here in Peoria County will continue to increase. The other thing that's been announced, not yet executed on, but has been announced, is that to help give some predictability to the amount of doses that are coming in each week, the plan is for the federal government to be able to announce what will be coming in for 3 weeks instead of for just 1 week at a time. That has not been executed yet. But I know that, and again, Monica can speak to this because she's the one on the ground making sure this all goes smoothly. But if she knows 3 weeks in advance how many doses she's going to get, she can better plan. And the people who are calling you about, am I going to be able to get my second dose, they'll have a little bit more of a level of relief that, yeah, the doses are going to be there. So that's right around the corner as well.
A bit off topic here, but obviously today's day 2 of the impeachment trial in D.C. A lot of people are saying right now there's only 6 Republicans who are seem to be for impeachment. Obviously 17 are required. In your mind, is it worth it to have this proceeding? Nothing that will happen from it.
Well, I'll quote from one of the impeachment managers who yesterday say there's no January exemption for the President of the United States. And I was on the House floor in the U.S. Capitol on January 6th when this crazed mob who was out to assassinate and to kill and to disrupt our democracy. I was there. And to say that because the president is no longer in office that we should just move on, we should not just move on. We need to deal with this. And I think it's the right decision to deal with this, whether the Republican senators support it or not. This is the right thing to do for the sake of our democracy.
How do you cross-check? So when you're saying that your system here statewide, and then there's the federal that's going to the Hy-Vees and all like that, how do you cross-check that someone in your system that you said you're going to be contacting, make sure they don't fall through the cracks or ends up going to the other provider?
So the question regarding the wait list that we have ongoing at not only our health department but other ones is the 2 ways that we check is the first one is we call them. We call them, we ask them if they have an appointment somewhere. If they do, then we thank them for keeping them on our wait list, and then we'll remove them because we want them to go to that provider. Most likely that would be a sooner appointment for them. If they've already been seen by another provider, then we take them off our wait list and we keep moving down. But in regards to just checking vaccine and if you've had a first dose, Illinois is lucky. We have what's known as iCare, which is our immunization registry. A lot of states have this, but I would say that our state has a really robust system. That means that if you get vaccinated throughout our state, your electronic health record, whether it's in a pharmacy program, the health department, what have you, gets filtered in. So to be able to provide COVID-19 vaccine in Illinois, you need to be on what's known as iCare. And so you might have gotten your first dose at the health department but lost your card. We can still look you up to know that you did have it on this date, and then you'd be able to schedule your second dose. So in Illinois, we have that system, which has made it really effective and has helped us, as a state, understand just the volume of vaccine that we've been processing compared to other states.
What is more the priority? Is it for getting the first dose into someone or the second one? Because there's only so many time slots.
Right now, our priority is to get as many people as vaccinated and fully. So, we open up our first dose appointments as soon as we get first dose vaccines, but we want to recognize that the way the Pfizer and the Moderna are set up is that it is a 2-dose component, so we make sure that we have an incoming allocation of second doses. But it is important for people that did get their first dose to come back and get their second dose in that proper time frame.
It might be more for Sherry or either. What's a realistic time frame for everybody to get their first dose and or second? Are we still talking July 4th, or is that very optimistic, or are we looking into the fall or 2022?
I think the biggest thing is just seeing the outcomes of everything that's been moving in the past few weeks. And so right now, if we see our numbers start increasing in terms of allocation slowly but steadily, Peoria County alone is 180,000, but I always like to remind people, especially with the Pfizer Moderna, we're actually vaccinating 360 people because we have to do 2 doses. And so with that type of capacity, if we start seeing that volumes of 10,000 to 20,000 come into a community, we would be hoping to sometime in the summer and early fall to be able to get a handle of it. Now again, not everyone will accept the vaccine, so there's a lot more work still to come.
Is a mass vaccination site in the works for Peoria or Peoria City or Peoria County?
We're always talking about different locations as well, and it's not unheard of. We've always been planning for, in terms of public health, for these type of mass sites, whether it's a drive-through clinic or a standalone operation, similar to how we did it with H1N1.
What defines a mass vaccination site?
The scale of it, and mass
Yeah.
vaccination, sorry, the scale of it, as well as it might be a centralized location, not necessarily be a closed pod, as we call a point of dispensing.
Is there a minimum scale that has to be to reach, or it just has to appear to be a mass one?
A mass would just be the fact that the volume that you're pushing through at a time.
Okay.
Yeah. Are there any more questions for myself or for the?
I have one more question, I'm sorry. In terms of hospitals deploying the vaccine, you mentioned that they're coming from the federal level or from the county level?
From the county level, the counties are the ones who allocate to the hospitals. So our hospital systems, which have done a great job vaccinating, they're averaging about 600 to 700 a day. That's vaccine that was provided them through either Peoria, Tazewell, or Woodford County.
Is someone paying the hospitals to do that work as well?
No.
No. So they're doing it free of charge?
They are doing it, they are able to, everyone is able to actually bill for the administration of it. Many of us are not, because we recognize that this is how we move forward.
So you said some are billing, most are not. Who is billing? You said?
I can't tell you. I know here in Peoria County, we are not billing currently at the site.
And the hospitals aren't either?
You would have to ask them directly.
Do you know how much they bill for in terms of vaccination?
It's for insurance, and it's minimal.
So I guess one question I have is, given that we seem to be getting a relatively steady dose of vaccine for the moment here, how soon would you be able to project, based off of the last few weeks, how soon we get through 1B to 1C?
1B, again, is our largest group, and we have a good understanding of the population. So 65 and older for Peoria County is about 30,000. I would say that, in about a month and a half, we'll get through the 65 and older, but there's still that larger group, which is the frontline essential, our educators, as well as manufacturing, and a lot more. And so it could still be a couple more weeks after that. That's why that allocation is really important for us, so that we can do it quicker. And with this whole idea of variants coming in, you want people to get vaccinated faster, too, to decrease the chances of mutations as well.
The big news, too, at PPS is that March 1st is when Dr. Crowd was looking for a resuming date. Will teachers be able to get vaccinated before that vaccine date, or it's still too soon to be able to vaccinate teachers to a full extent?
So we've actually provided all the school districts in Peoria County with the ability to register for vaccines. And so they've had it for a couple of weeks now. And in fact, I would say we had a lot of our schools come through in this past 2 weeks. And so they have the link. They're able to continue to refresh to check to see when appointments become available.
And all teachers qualify in that frame?
They do.
I know that the health department's been working with the schools, right, basically throughout this whole process to see when it's safe to return. So what was the thought going into it that it is safe to return, like he was saying, on the date they have set?
So, Peoria Public School District would be actually the last school to come into a full, and not all of their students, I believe, are coming in as well. I think it's a certain grade levels as well. But I would just say, compared to other schools that might have started the fall, Peoria Public is entering with the fact that they have Binax now, or point-of-care testing on site. Their staff has been trained and given access to contact tracing databases as well as Assist. And so, along with all the other mitigations and the best practices that they can put in place effectively, they're entering this in a strong point. And so, again, nothing is going to be zero risk, but they have really worked hard to minimize as much as they can.
One other thing on schools. As part of the next COVID relief package, there's funding in there to help make sure that K through 12 schools throughout this country can reopen safely. So there are, in addition to the job that Monica and the healthcare providers have to vaccinate people, there will also be physical needs at the schools. So ventilation systems, dividers. There might need to be build-outs for more room. So there will also be funding from a longer-term perspective of what our public schools will have to do to be ready for this on a long-term basis as well. So there's funding that is part of the next COVID relief package for our public schools as well.
Congressman, I asked before about the 100 shots, 100 million shots, 100 days. And obviously, you said we're probably going to exceed that with the way it's going right now. There's been estimates before in previous days it would take several years at this rate to fully vaccinate Central Illinois. Do you expect that to change?
It's not going to take several years.
What will change to ensure that that doesn't happen?
We've got, President Biden has been in office for 3 weeks. Up until that time, we had no national strategy, nothing. We had no national strategy to deal with this. We have a national strategy now, and we'll get the job done. We've got willing partners in the public health departments, in our hospitals, our clinics. We've got a community. We have communities all over this country that want to get back to normalcy. It is this vaccine that allows us to get back to normalcy. So there's a sense of urgency around this, and we'll get the job done. Okay, thanks you guys, appreciate it.